time now for our daily crisis update. We will start, as we always do, with the numbers, with, of course, all the appropriate caveats that these are approximations given the limits of testing and also the limits of transparency in certain countries. Let's go ahead and put them up, though. We can see in the U.S., we now have 429,000 plus cases and nearly 15,000 deaths. That's about 2,000 more deaths between yesterday and today. Worldwide, we see 1.4 million plus cases and 89,162 deaths. And Saagar, an area that people are starting to look at that are increasingly having outbreaks is, this really hit the big cities first and hardest, both with the amount of travel that occurs there and also the tighter living spaces. You're now starting to see outbreaks in almost every rural part of the country as well, so something to keep an eye on.
Yeah, it certainly is. It's one of those things where the cases are going to make their way kind of through the country, and some of the more troubling news is that we're actually seeing spikes in cases in places like Singapore and Japan, where we had thought that the virus was out of control or under control. They had social distancing, they had contact tracing, they had travel bans, all that stuff. But you know what it really is when you open up economic life too soon, when the restrictions start to loosen, the cases start to go up, and it's an endless juggle between policymakers. Can you let people out? When the cases seem down, people are going to start chomping at the bit to get out.
Yeah.
But there's a consequence that comes with that. And really, what society and life may look like is just a series of ebbs and flows until we get therapeutics and we get a vaccine.
Yeah, we got to learn those lessons as we watch other countries try to handle this as well.
Yeah, and at the same time, here in our own home city, here in Washington, D.C., about 2 weeks behind New York is what some of the experts are predicting, that D.C. is on track to become a coronavirus hotspot. So there's about 9,000 confirmed positive cases, 188 deaths from coronavirus reported in the DMV area. So that's D.C., Maryland, and Virginia. And local and national officials are warning that the region could become a bit of a hotspot. The reason for that is that that's kind of the way that New York became one, which is that you saw cases would build, slow rise. But that's the thing about exponential growth, is that one day you can be at 118 deaths, and then the next day you can be at 300, and the next day 600, right? And then at the same time, hospitalizations start to go up and all of that. And I mean, we say it pretty definitively. Governor Larry Hogan of Maryland saying that this region is on its way to becoming the next hotspot. And everybody's studying very closely what they did in New York City and in other places that locked things down. We're seeing some success stories in the United States. San Francisco was one of those. The entire, the Gavin Newsom looking very good right now in his decision to shut down California early. So maybe some lessons to be learned there.
Well, and I think D.C. did shut down quicker in terms of their progression of the virus than New York. So that gives us some cause for hope. Concerning, of course, you have a lot of essential government workers here who still have to come in and do their jobs, and also in order to properly run the functions of the government that all of us are relying on more than we ever have before. So why it's an important story, not just for here, but for the entire country.
Yeah, and the other problem is that it's projected to be a hotspot right around the time that the Congress was supposed to come back to vote. So
maybe they should have
maybe
remote
they should have
voting.
been here the whole time, or they should have just been having remote voting.
Speaking of voting, as you all know, much to our chagrin and to the just insanity of anyone with half a brain in the country, Wisconsin went forward with their primary in person this week on Tuesday. Now, this was the result of failures basically on multiple levels. The Democratic governor wanted to sort of shift responsibility to the legislature. At the very last minute, he did try to stop the in-person voting 24 hours beforehand. A conservative-dominated Wisconsin Supreme Court, and then backed up by the U.S. Supreme Court, caused those elections to go forward. On the other hand, Democratic leadership, including Joe Biden, were still encouraging voters to go out and vote and said, this is fine. It's way different than a convention. We can do this. We can sanitize it. So failures all the way around. And everyone, as I said, with half a brain looking at this and going, are you absolutely insane? They also had to close many of the polling locations because of a lack of polling workers. So in Milwaukee, major U.S. city, you had 5 polling locations open, meaning that you had voters congregating in long lines trying to exercise their franchise. So, surprise to no one, now we're getting responses from public health experts who are saying, literally, what a disaster. One was quoted as saying, I don't get it. I honestly do not get it. Another, when asked whether this would impact Milwaukee and Wisconsin's ability to flatten the curve, they said this was a disaster without question. What a disaster. I mean, these are some of the quotes that are coming from public health experts, which, not surprising. Anyone who's been following this news or watching the news at all could have told you this.
And we learned the lesson from Florida. We saw it, poll workers getting sick, coronavirus, people who had showed zero symptoms exactly 6 days after voting. Lo and behold, they're the people who contracted coronavirus. It was a disgraceful situation all around. Establishment Democrats and many Republicans all voted for it to go forward because they seem to care a little bit more about the vote totals in the elections than they did about people's lives. And so just an unconscionable situation.
No, they effectively weaponized a pandemic in their own attempts to gain power. I mean, that's what happened. And that's why the DNC and Joe Biden wanted to go forward with Arizona and Illinois and Florida, states that have large elderly populations. That's why Joe Biden still wanted to go ahead with Wisconsin. That's why the Republicans, the conservatives on these courts, there was a big court election in this particular primary that was really important and significant to both Democrats and Republicans in the state. Republicans thought if turnout was down that they could win that seat, which is just, again, unconscionable weaponization of a pandemic, willing to put voters' lives at risk. People may literally die because of these decisions that were made, but they're happy to do it if it means they get to keep their hold on power.
And that's the story of our country, isn't it?
There you go. All right, we'll have more for you later. Thank you all so much for watching.